there, I'm Jennifer Kosova from Noble Functional Medicine. Today we're going to talk about the optimization consultation. The optimization consultation is our initial intake visit that we go through a head-to-toe analysis of our patients, starting with a comprehensive past medical history so that we can learn all of the things that you've been through, what kind of diseases you might have been diagnosed with, review any previous lab work. We talk about your family history, any pregnancies, any hormone replacement you've attempted, look at your current supplement regimen, your exercise regimen, and your nutritional regimen. And we review a comprehensive lab panel. We go through all of your labs and we look at not just to make sure that they fall into the ranges that the lab gives on the right side of the paper. Those actually aren't normals, those are averages, and we don't want you to be average. 50% of our country right now has either pre-diabetes or diabetes. So the last thing we want to do is compare you to average. We want to figure out what end of the range is an A+ on each test, and then figure out what we need to do to help you get there. By doing that, we can make sure that we're keeping all of your body systems healthy and decreasing your risk of chronic diseases like cardiovascular disease, heart attacks, strokes, metabolic syndrome like diabetes, and cancer and Alzheimer's. And so we're going to go through some of the things we evaluate here in the optimization consultation. Let's get started. So as I mentioned before, we look at your cardiovascular health. We look not just at your cholesterol markers, but we also look at some of the advanced tests like lipoprotein analysis. Some people are genetically predisposed to having high cholesterol, and they've been passed down genes that make them produce larger, uglier cholesterol molecules than people who don't have those genes. So depending on what genes you've been given, the types and amounts of cholesterol you produce, this tells us a lot about what we need to do to keep your cardiovascular system healthy. Cardiovascular disease is the #1 killer of people who don't smoke. And so really we pay a lot of emphasis on this particular biomarker. The sex hormones might be one of the primary reasons people visit me, is because they feel that their sex hormones are out of whack. Either a woman going through perimenopause or menopause, going through a dropping testosterone or growth hormone. All of these things can create imbalances in the way you feel with mood swings. It can create problems like infertility, decreased libido, decreased ability to put on muscle, and low bone density like osteoporosis. Intervening early with these things is key. In menopause, there's something called the timing hypothesis, where we believe that the negative effects that women have on their glucose management and their bone density when they go from their 50s to their 60s is because of the sudden drop in estrogen that occurs during that time. And really heading off that drop and making sure that never occurs, specifically during that time while it's happening, is the best way to avoid worsening of diabetes, cardiovascular risk, and osteoporosis in people that are going through this phase of their life. Metabolic health. Metabolic health is linked to a higher risk of other chronic diseases. If you have a poor metabolism, if you're not able to utilize your glucose and your insulin effectively, if your liver is not doing a good job at getting rid of your toxins and your cholesterol in performing chemical processes that allow your body to excrete toxins, then you are going to start to suffer from poor metabolic health, and you have a higher risk of diabetes, Alzheimer's, and even cancer. Thyroid function is very important. Thyroid testing is very minimal under your normal screening guidelines. Usually it's only the brain stimulating hormone that gets checked and not the free hormone levels themselves. Working with somebody that really understands how to assess your thyroid gland and assess the function of the gland is very important. It's also important to get tested for thyroid disorders like autoimmune Hashimoto's thyroiditis. Many people have thyroid antibodies circulating, attacking their thyroid gland. And until it changes the level of the brain stimulating hormone, nobody might ever look any further. And we know that people with these elevated antibodies, their thyroid gland is getting attacked, and their thyroid tissue, if you look at it under ultrasound, looks different than a person that doesn't have thyroid antibodies attacking it. And so while some providers might dismiss elevated levels of antibodies until they affect the actual function of the thyroid gland, we know that it's affecting the thyroid gland at the tissue level, and there are many things that we can do in regards to lifestyle changes or supplements that can improve this before you suffer too much damage to your thyroid tissue that it actually affects the hormone level itself. And so working with a functional medicine provider to evaluate the thyroid gland, I believe, is superior because we look a lot deeper and we act a lot sooner before there's chronic disease that sets in that then you can only take thyroid replacement to fix, and there are no other options for you. We do a gentle cancer screening in the optimization consultation. The reason why I say that is cancer is a tough thing to screen for. There is no blood test that's a yes or a no. Since cancer can occur in any part of the bodies, or it even can occur spread out through the lymph system or the blood, it's really important to be looking at the big picture when we talk about cancer screening, and then focusing in on specific organs and making sure that we're watching them closely. For instance, women should have annual pap smears to look for cervical cancer. Men should have an annual PSA blood test done, which is a marker that tells us if the prostate is growing abnormally or too quickly. There are other areas like the colon that need to be screened to look for colon cancer. Obviously, you can't see any of the colon from the outside. You have to look inside with a camera in order to detect cancer. We're seeing colon cancer younger and younger. People that have genetic abnormalities, things like Lynch syndrome, mean that you need to get screened for colon cancer more frequently and earlier. People with a BRCA gene mutation need to be screened for breast, uterine, and ovarian cancers frequently. So cancer screening, we do a little bit of in the optimization consultation, but we also talk about the intervals for screening that are specific to you, whether you're male or female, whether you have a family history of certain things or not. Brain health. We look a lot at brain health, and the good thing about the brain is that whatever is good for the heart is good for the brain. And so all of the things we do to protect the heart, all of the things that we do to protect your metabolism really are going to downstream have a good effect on your brain. With the brain, you want to make sure that you're utilizing fuel appropriately, and that all boils back to the metabolism. The brain is the highest utilizer of fuel in your body, so it needs glucose. It needs insulin for your glucose to be effective in getting inside of the cells. And when you start to get insulin resistance and pre-diabetes and diabetes, that system suffers. That's why we're starting to call Alzheimer's diabetes type 3 or diabetes of the brain. And people will typically see signs of this before they're diagnosed with prediabetes that presents as brain fog. And that could be a sign that your body is actually not working as efficiently through its metabolism as it should. And we need to address that sooner rather than later. The brain also needs good amounts of vitamins. It needs low inflammation to be able to do cellular cleanup to avoid building up debris that later on gets recognized in Parkinson's or in Alzheimer's disease as tangles inside of the neural tissue. Body composition, very important. Actually, obesity is the second highest modifiable risk factor to prevent cancer, just behind smoking. I think we all know that smoking is a big risk factor for cancer, but I don't know if many people understand that obesity is the second highest risk factor that you can control. And so we take great pains to make sure we dial in somebody's current body composition and then monitor it as we are going through any weight loss program or body composition change. If we're trying to burn fat and build muscle, then getting a DEXA scan or a non-radiation body composition scanner like the STIQ machine we have, we can really get an idea of how much fat you're carrying around versus how much muscle. And we can also keep an eye on, as you lose, that the loss is coming from the right place, from the fat and not from the muscle. We can also keep an eye on your abdominal circumference, which is a great metric at measuring how flexible your metabolism is and how much you're responding to treatment. Micronutrients. Micronutrient levels are very important to have dialed in. Your body needs vitamins and minerals in order to perform all of the little chemical reactions that we use to fuel our metabolism, to burn fat, to build muscle, to build healthy bone, and to have a healthy liver that detoxifies. You need essential vitamins and minerals in order for all of these functions to occur. So when we talk about your cardiovascular health, here are some things we look at. We'll look at your blood pressure. If you're having your assessment done in an office or at your home, then we will be taking your blood pressure for you. If you're doing a telehealth consultation, then we'll ask you to either note the blood pressure at the drugstore next time you're there, or at your last doctor's appointment, or to order your own cuff that you can do manually off of Amazon or another medical supplier. We want your blood pressure to be around 120/80. Blood pressure is a pretty simple concept to understand if you just think about a fire truck and your garden hose. If you were to take your garden hose and hook it up to a fire truck, you're going to see that the pressure that comes out is too high for the hose and it's going to tear your garden hose. Those fire truck hoses are more equipped to deal with that high pressure. And so since your blood vessels, your arteries, your veins, your capillaries are just made of tissue, they're terrible. And so when your blood pressure is above 120 consistently with every heartbeat through so many decades of life, you're going to start to tear and weaken those blood vessels. And those blood vessels feed your organs. And the smaller the blood vessel, the more delicate it is, and the more likely it is to be the end point where it goes into the organ to feed it. And so when you start to tear and chew away at those connections there, then you interfere with that organ's ability to maintain good oxygen, good blood flow, delivery of all the nutrients that it needs to keep it healthy. We're going to take a deep look at your cholesterol markers. Most of us know our LDLs and HDLs. Many of us have heard them inappropriately referred to as your good and your bad cholesterol. And so an oversimplification that makes it not true anymore. The LDL and HDL are actually carrier molecules. They carry your cholesterol around your body to be either delivered to the artery wall or delivered away from the artery walls back to the liver, back to the colon to be excreted. So you can think of them kind of like garbage trucks, right? You have garbage trucks driving around, picking up all this garbage, bringing it back to the dump sites or to be incinerated. But you don't know how much garbage is in each truck. You just see a garbage truck driving down the road, or you see the garbage bins sitting out on the curb, but you have no idea what's actually inside of it. We actually look at the particles. We look at the apolipoproteins, the lipoproteins. Some people are genetic builders of really aggressive, ugly, big cholesterol particles that really increase their risk of developing a heart attack or a stroke. Some of these aren't tested for, many of them aren't tested for in your traditional lipid panel, and we're going to look at those in the optimization consultation. We'll see if you have signs of hereditary or a genetic disorder that's been passed down that makes you at higher risk. And if you're one of those people, it just means we need to be a little more aggressive. We need to think a little bit further beyond the guidelines that are just intended to keep you out of the hospital at a financial cost that your insurance company can tolerate. And we don't really want to use the numbers that your insurance company gives as what they're willing to react to. We want to use science and knowledge and what your individual risk is of having an event and treat you as an individual and assess your risk specifically as it relates to you. We'll make comments about that during the optimization consultation and let you know if there is a level of one of these more aggressive lipoproteins that you need to be a little more cognizant of and need to be more aggressive with your cholesterol management because of. We're going to look at inflammatory markers. Your CRP and your homocysteine are markers that can tell us if you're having a lot of inflammation or if you are genetically predisposed to just be bad at dealing with inflammation. We're going to know that too. One of the biggest causes of an elevated homocysteine would be a gene that makes you methylate poorly. And this can be solved with something as simple as just giving methylated folate and B vitamins to you. So this is something that we look for because it's something that's very easy to fix, but you have to know it's there first. The resting heart rate and your heart rate variability can be calculated. This requires measurement of your vital signs. And so, this can tell us a lot about the flexibility of your cardiovascular system. A lower resting heart rate. I think a lot of people have read that Lance Armstrong, who's metabolically very healthy, has a resting heart. Some of us have it in the 70s or the 80s. The variability between heartbeats is also important and can tell us a lot about how your heart recovers between beats, how flexible your metabolic system is, and your vascular health. CT imaging is not something we do during the optimization consultation, but something we may recommend. If you have signs of elevation or abnormalities in any of the above factors, then we might recommend you go get a coronary calcium scan. A coronary artery calcium scan can be done with or without IV contrast. The one without IV contrast is cheaper, it's faster, it's a little less invasive because you don't get an IV, but it also tells you a little bit less than the information you get with IV contrast. With IV contrast, you can see the difference between hard and soft plaques. You can also measure the plaques a little bit better and stage them to see how close are they to occluding the artery and how significant is the disease. Depending on your family history and your blood pressure, your cholesterol elevations, your inflammatory markers, and your risk calculation, we might recommend the CT with dye over the one without dye to get a better look at what's going on with you. When we look at your metabolic health, we're going to look at your glucose management. When you take in a carbohydrate, it will break down ultimately to glucose, or as fasting blood sugar. This is the primary source of fuel that your body uses. And as we talked about before, your brain is your highest utilizer of fuel. So making sure your glucose management is efficient is going to be brain protective. For anybody that's dealing with brain fog or slowness in their mental acuity, this is the right place to start looking. If you're having elevated fasting glucose, this is a sign that the system is being stressed. The next place we look is at the fasting insulin. These two markers together tell me a ton about how metabolically flexible you are and how healthy you are and what your risk is of developing diabetes, Alzheimer's, and even cancer. Fasting insulin is very rarely measured in a primary care doctor's office, unfortunately. The higher this level is, it tells me that your body is having to squirt out so much of this stuff in order to deal with the glucose you're giving it. And that's a bad sign. Your body should work efficiently on a very little amount of insulin. If it has to get a high amount out in order to create the response, and gets higher and higher and higher, almost like a drug addict, it needs more and more and more to satisfy that need, then that means we need to work on the glucose management. We need to look at the sources of carbohydrates that are going in, because usually what's going on is the carbohydrates that are being taken in are the sugary type, not the fibrous type. And when you think about carbs, you want to think of them as either sugary carbs or fibrous carbs, and err towards the fibrous ones and decrease the sugary ones. And that's what's going to help this system improve. Liver function. Your liver function test that we look at in traditional labs are just the liver enzymes. They're proteins that the liver makes when it's working. And if the liver is overly stressed, working overtime, if there's damage to the liver, inflammation on the liver, or it just is suffering too much of a toxic burden either from our environment or what we're feeding it, then those tests can become elevated, almost like an SOS signal that your liver is excreting to tell us there's a problem. We do more than just look at your traditional liver test. We do a calculation called a FIB-4, which looks at a handful of different biomarkers and comes up with a calculation that tells us how much risk your liver is suffering right now. When we see elevations there, the next step is to perform a FibroScan. A FibroScan is similar in technology to an ultrasound. It's a painless scan, but it actually takes a look at the liver tissue in a way that an ultrasound cannot. It will look at a fatty liver and actually be able to stage how much fat is on those cells. Because as the liver changes from a spongy, healthy, fat-free cell, it becomes congested with fat. And then once it's congested with fat, it will start to get inflamed. And that inflammation takes that nice spongy, healthy cell and makes it stiff. And then that stiffness becomes fibrosis, and then that becomes cirrhosis. At the end of the spectrum there, where there's fibrosis and cirrhosis, that's beyond repair. Those cells are done. You're not going to regenerate them. The liver is incredibly restorative and regenerative, but the cells have to be still healthy and not fibrotic in order for that to happen. So if we're just trusting the liver enzymes to tell us when there's a problem, we're going to miss the opportunity to treat the liver while those cells are still healthy enough to be treated. And so we will recommend a FibroScan of the liver if we see any elevation or if we have a FIB4 score that's elevated. Gut health. Gut health is also very important to your metabolism. Your GI tract is not just for pooping. If you think about what a sandwich looks like before it goes in and when it comes out, a lot happens to it along the way, right? And so your body first has to digest that sandwich in your stomach using a variety of acids to break it down into tiny, tiny microscopic chemicals that then pass into the small intestine and get absorbed there. Your body takes all the nutrients that it needs out of it. Then it goes further on to the large intestine where the fiber that was in the food that you ate, it's absorbed and coats the lining of the colon, and it feeds the microbiome, the good bacteria that live inside of us and keep the bad guys away. Those good bacteria need to be fed because they line the inside lining of the colon and they keep all of what shouldn't get absorbed through into your body inside of the colon so you can poop it out. The problem is when that layer wears down, if we don't feed our microbiome or we're not feeding our microbiome the right stuff, what happens is the lining to the colon weakens and it becomes more permeable. Things can pass through that aren't normally supposed to pass through and get into our abdominal cavity. And that's when we experience things like bloating, and the term leaky gut gets applied. So keeping our gut healthy, feeding our microbiome, recognizing bloating, diarrhea, and constipation as signs that there's a problem. It's only going to get worse and then cause systemic inflammation, overreactivity of the immune system, downward spirals of the cortisol levels being spiked. Your gut health is very important. You actually have neurotransmitters that are made by your GI tract from having a healthy microbiome. You actually are creating serotonin in your intestines, and that's the healthy, feel-good neurotransmitter for your brain. So really important to keep gut health in check. It's more than just for pooping. Kidney function is important. Your kidneys are filters. They're very smart filters. They're able to basically get rid of every single chemical in your body and then selectively filter back in the ones that are needed, then remove the rest in the waste through urination. And so, it's important for maintaining a good fluid balance and making sure you're hydrated, but it's also important for all of your electrolytes. Your sodium and your potassium, your calcium are all regulated through your kidney. And those are ions that help your heart muscle function and all of your muscles in your body function. So really important to keep good, healthy kidney function. When we talk about glucose management, hemoglobin A1C is a valuable tool to look at. The hemoglobin A1C actually is a 3-month report card of your glucose management because we test it from inside the red blood cell, and the red blood cells live for about 3 months. And so the hemoglobin A1C is a number that as it goes up, shows that you are not managing your glucose very well. And so if you have a hemoglobin A1C between 5.5 and 6, you're going to be warned that you're pre-diabetic. Anything above 6.5 is considered diabetes. Now, this study here looks at the all-cause death based on a person's hemoglobin A1C. And you'll see at the lower end of the spectrum here, this at the range of less than 4.5, we're seeing 5.7 deaths per 1,000 people with that level. If you jump up to the greater than 6.5, the diabetes range, people that have a hemoglobin A1C greater than 6.5, we're seeing all-cause death of 24.6 people per 1,000 people. That's a pretty significant jump. And so that's about a 5-time difference in mortality just based on this hemoglobin A1C number being higher than this one. And so that tells you right there, the better you can manage your glucose, your insulin sensitivity, you're going to decrease your overall mortality risk. So obviously we aim for the numbers that are at the lower end of the spectrum. When it comes to liver health, we have touched on this already. Liver cells are soft and spongy when they're healthy. They become firm and fibrotic as we progress towards cirrhosis. The time to treat them is when they are in the healthy range or in the fatty range or even in the inflamed range. But once we get stiff, fibrous cirrhotic cells, we can no longer affect that. The basic tests we do check your triglycerides, your blood pressure, your HDLs, your waist size, and your fasting glucose, because that's the calculation for metabolic syndrome. We also do a FIB-4 score that tests to see if you're at risk of liver damage. And then we do a FibroScan, which is similar to ultrasound technology and will give us a measurement of the fat and a measurement of the scarring so that we can monitor therapy and see how much at risk you are. There's also some advanced liver testing that we can do if we do find abnormalities within the FibroScan called an ELF test. And that also helps put together the picture of how fibrotic liver is, see if somebody actually has disease that's severe enough to require a biopsy at that point. The reason why we don't want our liver to get fibrotic and cirrhotic is because fibrotic, cirrhotic liver cells are what make you at risk of liver cancer. It's the #1 cause of liver cancer, and liver cancer is the #3 cancer killer. So we really want to be cognizant of this while we're in a range that we can fix. The sex hormones is everybody's favorite part. So really important to remember that whether you're male or female, you need testosterone. And believe it or not, men and females have highest levels of testosterone than any other sex hormone. Men have about 10 to 12 times the level as women. And that's why men tend to have more male characteristics. Those are testosterone characteristics of oily skin, hairy skin, and larger muscles, while women, because we have lower testosterone than men, have less of those characteristics typically. Testosterone plays a role in muscle development, also helps play a role in libido, also helps play a role in energy. Estrogen is very important because estrogen is cardioprotective. It's great for your heart, for your cholesterol profile. Women that go through menopause and have a drop in estrogen and don't get it replaced tend to suffer higher levels of fasting glucose and tend to have a poor metabolism than women that have normal levels or physiological levels of estrogen. Really important for bone protection. There is no drug on the market that is better at making bones strong than estrogen for both men and women. The brain, though, is the master control center. Nothing can happen in the testes or in the ovaries without a signal from the brain. And sometimes that's where the problem is. Sometimes the ovaries are fine, the testes are fine, but the signal from the brain isn't coming to them to tell them to do their job and make these hormones. And so we look at the brain control hormones, FSH and LH. Also prolactin is another hormone that we take a look at because at times there's tumors that grow on the prolactin area of the brain that can press on the other areas and cause them to hypo or hypersecrete. Prolactin tumors, actually benign tumors, are found in 10% of the population, so they're not completely rare. And when we find signs of elevation there, we'll recommend an MRI to look for those tumors. Thyroid function is, as I mentioned earlier in the lecture, very inappropriately screened for, in my opinion. Thyroid, just like the sex hormone, starts with a brain signal. The brain is the boss here. It sends a signal, the thyroid releasing and the thyroid stimulating hormone. That signal goes to the gland, which sits at the front of the neck here, and creates a pre-hormone called T4. T4 means thyroid 4. It has 4 iodines attached to it. It will lose an iodine in a chemical reaction to create the active hormone T3. Then you will have T3 circulating around in the body doing its job. And its job is to regulate your metabolism. It's your metabolic thermostat, if you will. It controls the speed that your body converts food into energy. It's really important for the growth and development of children, for the brain and the nervous system. Thyroid disorders in early childhood can lead to low stature and stunted growth. And so recognizing these in children is imperative. It also regulates your temperature by controlling how your body heat is generated. And so if you've ever had low thyroid, people with low thyroid tend to be cold all the time, whereas people with high thyroid tend to be really hot. Thyroid influences your heart rate. This is really what internally sets that clock of how your heart beats, and this is somewhat hereditary, believe it or not. Mood and energy levels. Proper thyroid function is important for mood and energy levels because of the production and the secretion of neurotransmitters. Sorry, I'm going to go back to thyroid for a second. I didn't talk about thyroid antibodies. Thyroid antibodies are interesting. Your body can actually create antibodies that think your thyroid gland is a foreign invader and attack it. This is really common in patients that have sensitivity to wheat. You don't necessarily need to have celiac disease to be sensitive to wheat. Some people's body, their immune system, falsely recognizes a wheat protein as being an invader. And wheat and the thyroid gland can look similar to the immune system. And so the body can form thyroid antibodies that will end up attacking the thyroid gland, thinking that it's an invader because it's made all these antibodies in response to wheat. Wheat isn't the only thing that can do this though, and so really doing some testing to find out if there's a food sensitivity at play, an environmental exposure, something that's causing the body to produce thyroid antibodies. But most primary doctors don't test for thyroid antibodies, and thyroid antibodies can take a very long time before they affect the numbers that we do test for. And so if we wait until these numbers become abnormal before we go looking for thyroid antibodies, then we miss an opportunity to treat this. And the danger in letting this go is that when the thyroid gland becomes under attack by antibodies, the tissue of the thyroid gland gets swollen with lymphocytes. It gets infiltrated with lymphocytes that crowd out the good tissue. So then you end up with less and less good thyroid tissue and more tissue that's been distorted and inflamed and is no longer functional thyroid tissue. So usually it's people that have progressed to that severe compromise to their thyroid gland, then they don't produce enough hormone, and so it's finally recognized. But now you have only a quarter of your thyroid gland left that's functioning at full capacity. It's too late. Kind of like the liver, we need to be looking at this now before those changes occur to the tissue that's making the hormones. Otherwise, you're not going to be able to make your own hormone with your own tissue. We're going to have you on thyroid supplementation. Micronutrients are so important. You need vitamin D for healthy bones, but you also need it for good immune system. The levels we accept as normal in the lab are very low. We accept 30 as a normal, but that's a D. If you think of it as a report card, that would be a D. You want your levels to be up closer to 50, 60, or 70 for adequate protection of your bone and your immune system. Being out in the sun will help, but it usually doesn't get you all the way there. B12 is an important nutrient as well. B12 is important for your hormones to go through the process of being utilized. B12 is important for energy production, important for DNA synthesis. If you don't have enough B12 on board, you're going to be fatigued and maybe even have some brain fog. Iron is important for carrying oxygen around your cells. Adequate iron levels are super important because if you have low iron, you can carry less oxygen. You're going to deliver less oxygen to your organs. Your organs won't be as healthy, and you're not going to have as much energy. DEXA scans, body composition. Body composition is very important because just stepping on the scale doesn't really tell you a whole lot about what's underneath the hood, right? How much of that weight on the scale is bone, how much is muscle, how much is fat, you have no idea. And if you're trying to lose weight, when you see that number going down on the scale, is it coming from the muscle, which is a no-no, or is it coming from the fat, which is a yes? So getting a body composition scan is very important and very helpful in making those decisions and knowing if you need to beef up your protein and your resistance training. Maybe you need some testosterone because you're low and you're not putting on muscle commensurate with the amount of work that you're doing and the protein that you're eating. So getting these scans can be really helpful in guiding changes to your plan. DEXA scans are great at that. They also give you a good idea about bone density, which is important, especially for menopausal women and keeping an eye on bone mass. With dropping testosterone that don't make enough estrogen because of that, also are at risk for osteoporosis or bone loss. So that's very important. We also have, in this practice, we use a radiation-free STIQ body composition scanner that allows us to track that fat as well, look at your visceral abdominal fat through waist circumference measurements, make sure that you're keeping adequate muscle on your bones, making sure you're keeping adequate muscle on your body and not dipping into your muscle pools, but rather only burning fat. You can keep an eye on that as you go through your body composition journey. Bone health. Bone health is very important, and I think that most of us don't think about our bones until we're older and we fall and we break one. But there is a pretty significant decrease in your lifespan once you break a bone as an older adult. If you are 60 years or older when you break a bone, your 5-year survival rate is only 50-50. So once you're 60 and you fall and break a hip, there's a 50-50 chance that you're still going to be alive in another 5 years. That's significant. That is not necessarily because of the fracture itself, but because of all the immobility and disability that comes behind that. It's hard to recover when you're older and you fall. Bed rest is more detrimental. You'll lose muscle mass, which is very detrimental to your lifespan. And so avoiding broken bones is imperative. Making sure that the bone is as strong as possible is one way, and then also making sure that our exercise regimen includes stability exercises to help prevent falls to begin with. You want to make sure that you're either getting a DEXA scan to measure your bone density. DEXAs are great at measuring bone density, but not actually as good at measuring bone strength. There's a newer technology called a REMS ultrasound. That's a non-invasive, radiation-free technology that's very simple and actually is a great marker for bone strength, because that is actually more important than bone density when it comes to measuring bone quality and fracture risk. There's also some very advanced blood testing that can be done to measure bone growth and bone breakdown, because your body is constantly growing new bone from the inside and breaking old bone down from the outside in a constant circular cleanup. And so knowing how that ratio is, how much bone making is there compared to bone chewing up, is really important, because if you're chewing up more bone than you're making, then we need to intervene, and that's usually nutritional intervention that needs to be done at that point. Brain health. Brain health. As I said before, what's good for the heart is good for the brain. I like that expression because it also makes it easier, I think, to make these lifestyle changes and do all of these interventions when you know you're not just helping one thing, but you're really creating a downstream effect on all of your organ systems by doing some of these maintenance, health maintenance things, and taking lifestyle into consideration. Your cholesterol and fatty acid balance is very important. You want to make sure you have good blood flow to the brain, and the vessels that are going to the brain, like the carotid arteries, are not stopped up with high cholesterol plaques being laid down over the years that's inhibiting good blood flow getting to your brain. Inflammation also disrupts the communication between cells. Those inflammatory mediators can block the ends of the neurons where the hormones are supposed to bind. And so you could have all the hormone in the world, but can't bind into the key and lock because there's inflammatory particles there. Then you're going to have brain fog, decrease in mental clarity, maybe decrease in libido, because your hormones can't get to the active site because of all the inflammation blocking it. Blood flow and pressure. The higher your blood pressure is, you're going to damage those tiny little capillaries and cause little micro tears, little disconnections of the blood to the tissue, and that tissue starts to starve, kind of like pulling a daisy that's growing on the sidewalk out and setting it on the sidewalk. You've disconnected its roots. You're going to come back the next day and that daisy is going to be dead. It's not going to be thriving. So we want to make sure we have good blood flow and good pressure to our brain, and that we're protecting those delicate vessels from prolonged exposure to high blood pressure. Blood sugar control, like we talked about before. Your blood sugar is your fuel that you use in your body, and the higher that blood sugar gets, the higher the insulin has to get in order for your body to suck it up into the cells. Your body starts to get insulin resistant. It gets harder and harder to push that insulin, that glucose, into the cells. And so your body becomes starved of fuel, and it happens first in your brain, since most of the energy that's used is used in your brain. You'll start to see brain fog when you're not having good insulin sensitivity, and your body's not using glucose the way as efficiently as it should. Genetics play a big role in your brain health. There is a gene called the ApoE gene that has recently gotten a lot of attention. If you have seen Sanjay Gupta's special, The Last Alzheimer's Patient, on CNN, a lot of good information about this gene. This is a gene that you get one copy from your mom, one from your dad, kind of like your blood type. You're either going to have a 2, 3, or a 4 from each parent. So you're going to have a 2, 2, a 3, 3, a 3, 4. Some combination of those numbers. You're going to have 2 of them. And if you have a copy of a 4 type gene, that means your body doesn't do a great job at getting rid of old cholesterol, and so you're prone to having high cholesterol. It also doesn't do a good job at cellular cleanup. You know, our cells die, just like our skin cells we can see. We'll slough off dead skin cells, but that happens in our brain too. And if those don't get cleaned up effectively, you start to get tangles in the brain. The nerves start to tangle together. There's a lot of garbage and plaques and things that the brain isn't capable of cleaning up. And this is where Alzheimer's comes from, one of the origins of the symptoms that we see in Alzheimer's disease. And so if you have one copy of a 4 of your ApoE gene, you have 3 times higher risk of developing you have a 3 times higher risk of developing Alzheimer's. If you happen to have gotten a 4 from both parents and your genotype is a 4-4, you actually have a 12-fold risk. And so patients can't really do anything to change the genotype, but they can react by making sure that their lifestyle is as clean as possible, that they're regulating their cholesterol, maybe through medicinal therapy if needed, if they're decreasing systemic inflammation, making sure that they're not taxing their liver with the excessive burden of alcohol and chemical exposures. These people really need to make sure that they're practicing every lifestyle modification because genetically they're not set up to handle all of these things well. The ApoE genotype test is an add-on test to the telehealth version of the optimization consultation. If you're coming to see us in the office for the full consult, this will be included in your evaluation. For cancer screening, as I talked about before, we do some basic blood tests for screening for cancer, but we do spend a lot of time talking about screening intervals and what screenings are recommended and why. We screen for PSA in the blood. PSA is a hormone that gets secreted from the blood when the prostate is growing. When the prostate grows, it can be a sign of just simple prostate enlargement. We don't like to see this though because the prostate is like a donut around the male urethra. And if it grows, especially in the middle where the hole is, it can squeeze the urethra. And if that happens, sometimes a man will need a catheter to be able to pee through their urethra, sometimes even a surgical procedure to roto-rooter that out. And so we want to be cognizant about watching PSA levels in men, and we want to do that at least once a year. For female screening, ovarian cancer is one of the more deadly female cancers. It's also probably one of the hardest to detect. Your annual pap smear doesn't check for it. With ultrasound, sometimes you miss ovarian tumors because they can occur more frequently in the fallopian tubes, and a lot of times those are bent behind the uterus or hiding behind an ovary on an ultrasound, and we might not see them. The CA-125 is a blood test that, when it's elevated, sometimes can be a sign of ovarian cancer. Unfortunately, this test can also be elevated for a couple of other non-cancerous reasons, so it's a loose screening test, but when it's elevated, at least it tells us that we need to investigate a little bit further and be a little more diligent. When it's low, we know that we can revert to our traditional screening and then screen more aggressively if somebody has symptoms along the way, like pelvic pain, bloating in the upper abdomen are 2 common complaints of women that go on to be diagnosed with ovarian cancer. So here's some things you'll need for your consultation. If you're doing the consultation over telehealth, then there are some limitations because obviously I can't put my hands on you to take your blood pressure, measure your waist circumference. We won't be able to do the STIQ scan in our office for you or draw your blood work. So what we'll need to do is have you note your blood pressure at your most recent doctor's visit. or you can purchase a blood pressure cuff to have at home and monitor yourself. And we'll use the number that you get in order to perform some calculations for your cardiovascular risk and your metabolic syndrome risk. Waist circumference. We'd like to get a waist measurement around the belly button. We use the belly button because that's just an area that you're going to be able to find all the time for consistency. We want to make sure that we use this calculation in your metabolic syndrome diagnostic profile because we check this box if men have a waist circumference greater than 40 inches and women greater than 35. And so having this number logged before your consultation will help us with those calculations. A DEXA scan is something that you can go to either a medical facility to get, or if you're here local in Los Angeles, or if you live in a big city, Body Spec is a company that I frequently will recommend for patients. They're very accessible, easy to get in and out. They have membership program if you're going to get frequent scans, if you're on a body composition journey to lose fat and gain muscle. This is a great thing to consider, joining the membership so that you can scan a little more frequently and check in on your progress. If you are a patient coming in for the in-office visit for your telehealth, if you're a patient coming in for an in-office consultation, then we will do a STIQ, our non-radiation body composition scanner, for you during that visit to get this information. And then if you end up joining our club, you'll have access to this machine during your follow-up visits. The laboratory panel. If you're doing a visit over telehealth, then I'll ask you to bring your labs to the visit. I'll provide you with a list of the minimum labs I'll provide you with a list of the minimum labs that we would need to get an effective evaluation of what's going on with the areas that we discussed previously in the slides. If you would like to use your insurance, although we don't take insurance at Noble Functional Medicine, we can provide you with a prescription to either Quest or LabCorp or the lab of your choice so that you can use your insurance and get those labs to bring to your telehealth appointment. We'll also have the option for you to add on our in-home service to collect the labs for you through our lab, and we charge $595 out of pocket for that, and that will cover the phlebotomy visit and the entire lab panel. You will want to log into the portal ahead of time. We have a secure electronic medical record portal for you to log into, where you can record your information. You can upload documents from previous labs, any prior studies that you've had, coronary calcium scores, food sensitivity testing, anything that you've had done that you'd like reviewed during your consultation. You can upload those into the portal. They will be secured. They are secure in there. They will be stored there. That's where you will find your treatment plan from me, any super bills for your consultation, invoices, etc. And you can communicate back and forth via messaging through the portal as well. Here's a couple of additional tests Here's some additional testing you might consider adding to your optimization consultation. We talked about the ApoE genotype. This is an interesting one to have done. You can add this on to the consultation, and it will give us an idea and a chance to talk about what your genotype means as far as your risk. Micronutrient testing is another type of test that can be added on. This actually looks at the intracellular micronutrient levels rather than just what's in the plasma. This is a really good test to have done if you're looking to start a supplement regimen, but you don't want to take any more than you need. This will give me an idea of exactly what you need, down to the milligrams of B12, B6, glutathione. It will look at vitamins, minerals, and nutrients. It will look at some antioxidants as well. An advanced lipid panel is actually a deeper dive into your cholesterol, where we measure not only the number of particles, but we also look at the omega balance. This is really good for people who want to start taking some omegas, EPAs, and DHA, and want to make sure that the dosage is appropriate for them. Food sensitivity test is a great one if you're having any bloating after eating, or any hives or rashes or food sensitivities. This can give you an idea of what you might be eating on a day-to-day basis that might be causing these underlying symptoms. Estrogen metabolism testing is a great type of test to do, especially for people that are on hormones or that are having symptoms of excessive hormones. And so this will take a look at how your body breaks down estrogen and excretes it, to look for toxic metabolites, look for genetic variants that could be interfering with the detoxification pathways. If you're not detoxifying correctly, if you're not detoxifying your hormones correctly, this is where your cancer risk can increase. The FibroScan of the liver we spoke about, that's the non-invasive screening that's similar to an ultrasound, but allows us to look at the stages of fattiness and scarring of the liver in order to assess your degree of liver dysfunction and how significant the need for fixing it is. An ELF blood panel, that's an advanced liver fibrosis blood panel. We would recommend adding this on if we find that you've had a prior history of elevated liver function, or if you've already had an abnormal ultrasound or FibroScan of the liver. Genetic testing for health insights. This is a genetic test that looks at about 30 different genes that are common and that can cause difficulties in either cellular cleanup, detoxification, utilization of your micronutrients or your hormones, and can give us some clues as to what types of lifestyle interventions, supplement therapies, or medicinal therapies might be helpful in preventing disease progression and keeping you healthy. All right, well, thank you so much for your time. That was a long one. I hope it gave you a good taste for what to expect during your initial consultation and onboarding with Noble Functional Medicine during your optimization consultation. If you would like to sign up for the optimization consultation, feel free to click here or visit the website to sign up for a discovery call with me to talk about your individual concerns. I look forward to meeting you.